As an audiologist with Bluegrass Hearing Clinic, I often get asked about the link between untreated hearing loss and cognitive decline. Unfortunately, there's been a lot of research on this lately. There was a huge study that came out of Johns Hopkins called the Achieve study that actually showed kind of what we all had suspected for a long time, that there was a large link between untreated hearing loss and cognitive decline. They showed a 48% improvement for people that treated their hearing loss versus the people that had untreated hearing loss when they were at risk for cognitive problems. Also, recently here just in 2024, the Lancet study came out and they showed that hearing loss is actually one of the 12 modifiable risk factors to prevent cognitive decline or dementia. So other risk factors that were identified on that study were depression and social isolation, which we see a lot with our patients because if they're not hearing well, they tend to not engage in conversation or social activities as much, which leads to auditory deprivation and depression. So really 3 of those things in that study are potentially improved by just treating their hearing loss. The other thing that came out of the Achieve study is not just treating your hearing loss with any type of amplification device. There was a difference between the patients that treated their hearing loss with just kind of a store-bought device or something like that versus the ones that treated it with a hearing healthcare professional and actually followed the recommendations, got prescriptive devices, and a follow-up treatment plan. So they showed that even though you just treat your hearing loss, it's actually more important to follow a prescriptive treatment follow-up care plan.
Ask an Audiologist is brought to you by Bluegrass Hearing.